Welcome back to the program. Again, it's countywide, and our guest today, David McAtee, Yavapai County Community Health Services. David's the Public Information Officer and been sending us an awful lot of information. Can we kind of, as we continue, follow along with those points you made? Tell me again, clean?
Separate, cook, and chill. Okay. So you've cleaned your surfaces, you've kept them separate in your refrigerators, and you've cooked or you've prepared your vegetables before your meat so that you're not, preparing your meats and then the germs and then the vegetables are spreading. So you've done that, and now you've got to cook it. And really the only way to know if you've reached that proper temperature of about 165 degrees is with a thermometer. So if you don't have one, go out and get yourself a cooking thermometer, because it's really the only way to know for sure. The myth that it runs clear, it's good, if the texture is right, it's good, those aren't true indicators of the right temperature. And not everything has to get up to 165, but that's kind of a safe temperature that you want to get your food to.
I want to ask you something about this. I like to cook, like to eat, like all of it. A lot of times I have found that if I prepare almost any kind of meat, poultry, red meat, whatever, to the temperature that is described as being the healthy kind, whatever it may be, it's overdone. I very often find that.
Yeah.
Even with the turkey last week, I've got the thermometer and it says, okay, in the thigh, kind of the dark meat, the 175, and I did, and the breast was not bad, but it was just heading that way.
Yeah. Well, there's a lot of ways to keep the moisture in, and that's one issue, using a bag.
Turkeys are hard to cook.
They really are. And the faster you cook it, the more juice it's going to hold, frankly, and then you're going to get up to that 165 quicker. There are wireless thermometers that you can put in your turkey and watch. That way you're not opening up the oven door. But, well done doesn't mean 165, or 165 doesn't mean well done. You just have to get it up to the 165 as quickly as possible.
Sure.
And then hold it there for about 5 minutes. That's all we really ask. And it's not going to be rare, don't get me wrong, because there are some concerns with that.
Sure.
But yeah, there are ways to do it. Just
uncooked poultry is
very dangerous.
Yeah, as we know, it can really cause problems. Yeah. How about uncooked red meat? Lots of folks like their steak rare, their what have you, rare.
Especially hamburger. That's really where you get into a little bit of concern. In fact, this past year, the supervisors adjusted the food handlers code, if you will, not to allow rare hamburger on kids' meals, because that's really where the danger is. The younger people whose immune systems aren't quite up to snuff, or the elderly, frankly, whose immune systems are kind of fading off, they're really more susceptible than anybody else to the germs and the bacteria that exists in raw hamburger.
You said the supervisors did that?
Yeah, the county supervisors approved basically this change to the food code.
Every now and again on this show, we really kind of highlight how stupid Brad is. And I had no idea that the county supervisors could make, or request, or however it works, an adjustment to those kinds of things. Well, I know about violations and some enforcement powers, but I thought all that was like, you hear about FDA, they're running the show.
Well, and that's really where we get it from. Honestly, our code is a couple years behind, and what our environmental health director basically said to the supervisors is, we'd like to get up to speed, basically, with the rest of the country. And these are the new rules and regulations, and one of them, which was that we're not going to allow restaurants to offer on their kids' menu raw hamburger or undercooked hamburger. Now, that's not to say the parents couldn't order it and give it to the kids. It's still your choice, frankly. But we're just looking out for those younger adult children who really need that protection. And so, yeah, the supervisors, they discussed it, they debated it.
Sure. I remember the conversation about the rules. I do recall that, so I'm being a little facetious, but not much. I think, even then, a little surprised to find, you're talking like chain restaurants, like the popular ones the kids love, that at the county level, there could be some regulation regarding those things.
Well, interestingly, as we went through and contacted almost every restaurant in the area, there were 2 that actually had it on their menu, and they had no problem removing it. Honestly, it was not, it wasn't a big deal to them. Yeah.
Let's talk a little bit about kind of acquiring our food and our meals in the public sphere.
Yes.
It seems like we've had a lot of food recalls. I don't know if that's quite the case. There's been an issue with the peanut butter thing in the organic plant in, I think, New Mexico that really had some troubles.
Right.
So that one's kind of bubbled back again. It's really been one issue, but it's returned. When we hear about a food recall, is that, oh my gosh, panic in the streets? Is that, well, I heard about that, I'm going to just not eat what I have, throw it away, return it, what have you? And How kind of serious do we take these things, or should we take these things?
Well, I would hope everybody takes them very seriously, because it can lead to some serious health concerns, in fact, in death in some cases. We have people die every year from salmonella and E. coli, and that's really what we're trying to prevent. So when you hear about a food recall, take it seriously. Look at what you've got. We post it on our website, anything that's applicable to our county on YavaPaiHealth.com. We post all of our food releases there. There are a lot. I get almost an email every day from the FDA saying there's been a food recall. Usually they're back east, but the only ones we really report are the ones that are applicable to our grocery stores, our local businesses. So you can follow us on Facebook. We have a Facebook account and Twitter where I always post the food recalls. But yeah, we really do suggest you take it seriously.
Yeah,
because it can get deadly.
I know that you don't have probably the specifics on Sunland. It sounds like this is the company that made this organic peanut butter. Went to a lot of places. Trader Joe's locally is, I think, the chain that was affected. But in a situation like that, we're hearing, I mean, they just found salmonella all over the place. And I know you're speculating, but is that just not doing things up to code? Is it a once off and, oh my gosh, we had this problem and it got out of hand? Is there any way to gauge that? Or
Well, the peanut butter one was interesting because from my research, there's only about 2 or 3 peanut butter manufacturers in the country. So when one of them has a problem, it's huge because a lot of different brands use the same peanut manufacturer. Jif gives them a formula, Peter Pan gives them a formula, and they all use their own specific formulas to make peanut butter, but at this central location. So when the FDA's inspection department, if you will, finds something, they basically shut it down and say, okay, let's look further. And when they find more, they keep searching until they don't find any more. The peanut butter was a bad one, and I think it's a good thing that we found it because it could have gotten pretty serious. A lot of times it's meat. This is just one of those products that carries a lot of germs, but the FDA is out there checking, and when we find stuff, to me it's encouraging because at least I know they're looking for it and preventing a lot of the disease that could be bad for people. So
you mentioned meat; it just made me flash on the mad cow thing in Europe a number of years ago. Now I know we've had some scares in the United States. I don't know if we've had a real kind of outbreak.
No, we haven't, not that I know of at least, and that doesn't mean we haven't had a case, but when they do find one, they shut it down, they kill a lot of cows, unfortunately, and it costs a lot of money, but they realize that this is a major staple that we survive on, and it's very serious, and they really do deal with it pretty well.
Get at it pretty quick. Okay. Let's go ahead and take another short break. We need to do that. We need to pause for a moment. When we come back, you brought to us some information about Yavapai Healthy Living Coalition. And not a new program, but going to be kind of new maybe to our listeners and be real interesting as well for folks to find out. We'll talk to David about that when we come back. David McAtee, our guest, Yavapai County. Can I say Yavapai County Health Department?
You can.
The Health Department is here. We'll be back after this.